Have you experienced nosebleed before? You may have seen blood running from your nose once or twice throughout your life. This is called epistaxis. Hello everyone, welcome to a new video on SMZ Precious Minutes. Our topic today is nosebleed or epistaxis. Epistaxis, conventionally known as nosebleeds, is the most common otorhinolaryngologic emergency. More than 60% of the population is affected at some point in time, with 6% requiring medical attention. We are going to explore the critical points about epistaxis, how to prevent and to deal with it. The function of the nose is to humidify, filter and warm inhaled air for delivery to the lungs. It has a rich blood supply to provide the warmth and moisture required to enable this, which makes the nose more susceptible to bleeding. Epistaxis is a common condition, experienced by approximately 60% of people at some point during their lifetime. Though often alarming to patients, only 6% of epistaxis cases require medical attention. Epistaxis accounts for 1 in 200 emergency department visits annually, or 1.7 emergency department visits per 100,000 population, and occurs in a bimodal distribution, with the majority of patients less than 10 years of age or greater than 50 years of age. The largest percentage of emergency room visits for epistaxis occur in patients aged 70 to 79 years. Most nosebleeds can be treated successfully in the emergency department. Though occasionally indicative of underlying pathology, nosebleeds are usually idiopathic and self-limited.
So what are the causes of epistaxis? Up to 85% of cases are idiopathic. The remaining causes split into local or systemic causes and contributing factors. Systemic factors are more frequently responsible in later life, with local factors more commonly responsible in younger patients. Neoplasia is a rare cause. Local causes include infection like sinusitis and rhinitis, nose picking, nasal fracture, cocaine abuse, nasal tumors, deviation of nasal septa, and most commonly unknown cause. Systemic causes include intake of anticoagulant drugs, liver disease and thrombocytopenia, constipation and straining, hypertension and atherosclerosis, and congenital causes.
So what about the clinical picture? Most often, you won't have any symptoms other than blood coming from your nose. If you have a posterior nosebleed, some blood may drain down the back of your throat into your stomach. This can cause a bad taste in the back of your throat and make you feel nauseated. Symptoms suggesting hemoptysis or hematmesis may indicate posterior epistaxis. Presence of nasal obstruction along with recurrent bleeding episodes may be suggestive of a tumor. If you have additional symptoms, it may be a sign of a medical condition. How can we deal with simple cases of epistaxis? Follow these steps to stop nosebleed at home. Sit upright and lean your body and your head slightly forward. This will keep the blood from running down your throat. Use a tissue or damp washcloth to catch the blood. Use your thumb and index finger to pinch together the soft part of your nose. Make sure to pinch the soft part of the nose against the hard bony ridge that forms the bridge of your nose. Keep pinching your nose continuously for at least 5 minutes before checking if the bleeding has stopped. If your nose is still bleeding, continue squeezing your nose for another 10 minutes. If you'd like, apply an ice pack to the bridge of your nose to further help narrow blood vessels. You can spray an over-the-counter decongestant spray, such as oxymetazoline, into the bleeding side of your nose and then apply pressure to your nose. You shouldn't use these topical decongestant sprays over a long period. Doing so can cause an increase in the chance of a nosebleed. After the bleeding stops, don't bend over, strain or lift anything heavy. Don't blow or rub your nose for several days. In cases with recurrent epistaxis or massive hemorrhage, you should see your doctor, who may perform one of these options. Nasal packing: your physician will insert gauze, special nasal sponges or foam, or an inflatable latex balloon into your nose to create pressure at the site of the bleed. Cauterization: this procedure involves applying a chemical substance or heat energy to seal the bleeding blood vessel. Medication adjustments or new prescriptions, reducing or stopping the amount of blood-thinning medications can be helpful. Foreign body removal. If the cause of the nosebleed is a foreign object, your provider will remove it. Surgery. Surgical repair of a broken nose or correction of a deviated septum if this is the cause of the nosebleed. Ligation. In this procedure, your provider will tie off the culprit blood vessel to stop the bleeding.
So how can I prevent nosebleed and protect my nose? You should consider these options. Nasal saline may be used throughout the day to moisturize the nasal cavity. Gel formulation may be applied to the anterior nasal cavity to increase moisture and promote healing. Humidified air. Home humidifier unit assists in increasing the humidity of inspired air. A high humidity face tent or a humidifier added to the nasal cannula may aid in humidification of inspired air for patients with chronic oxygen dependence. Things to avoid. You should avoid digital trauma, nose blowing and strenuous activity for at least 1 week after being treated for epistaxis. Irritants, like cigarette smoke.
Here we come to the end of our video, and this is what you shouldn't forget. Epistaxis is a common presenting symptom that can be simple and uncomplicated or associated with an underlying complex issue. Most events are minor and self-limited. Rarely, epistaxis may lead to death. That's all for now. See you later in upcoming videos on SMZ Precious Minutes. Until that time, keep safe and take care of your nose.